Neurology quiz number 42. What is progressive encephalomyelitis with rigidity and myoclonus, or PERM? PERM is a life-threatening neurological disease that can be associated with glycine receptor antibodies. The condition affects men and women equally and can occur in children and adults. Clinical features include muscle rigidity, muscle spasms, myoclonus and hyperexplexia, evidence of brainstem dysfunction, long track signs and dysautonomia. Rigidity and spasms are most common in the distal limbs but can also involve the trunk and proximal muscles. Brainstem signs include ophthalmoparesis, nystagmus, opsoclonus dysphagia, dysarthria, and deafness, and these may precede muscle rigidity. Long track signs include pyramidal track signs as well as cerebellar ataxia. Autonomic instability and dysfunction is common. Less common features include neuropathic pain, seizures, and cognitive disturbances. PERM shares clinical features with stiff person syndrome and is sometimes labeled as SPS+. The diseases are considered part of a spectrum. Most patients have antibody to glycine receptor, and a small number of patients have antibodies to GAD65. Conversely, some patients with SPS may have anti-glycine receptor antibodies. The antibodies are detected both in serum and CSF. Less than 20% of patients who have glycine receptor antibodies and neurological disease have underlying malignancy, most commonly thymoma and lymphoma, as well as cancer, breast and lung. Autoimmune diseases that may be associated with PERM include type 1 diabetes mellitus, thyroid disease, rheumatoid arthritis, and myasthenia gravis. Workup for diagnosis and to rule out other conditions includes serum anti-glycine receptor antibodies and GAD65 antibodies, MRI of the brain, EEG, and EMG. If underlying malignancy is suspected, workup should be ordered, especially for thymoma and lymphoma. Differential diagnosis includes stiff person syndrome, anti-pptx, encephalitis, CNS Whipple's disease, Creutzfeldt-Jakob disease, tetanus, neuroleptic malignant syndrome, Marwan syndrome, among others. Treatment, symptomatic treatment. As in stiff person syndrome, benzodiazepines are the first-line treatment for muscle rigidity and spasms. Diazepam is started in a dose of 5 mg 3 to 4 times a day and titrated up. Alternatively, baclofen can be given in a dose of 10 mg 2 to 3 times a day and gradually increased. For hyperexplexia, clonazepam is the medication of choice. Medications for myoclonus and seizures include levetiracetam and valproate. Immunomodulatory treatment. Treatment is usually started with IV solomedrol 1 gram a day for 3 days, followed by oral prednisone 60 mg q-day. As many patients have a life-threatening and rapidly progressive course, treatment with IVIG and or plasma exchange is instituted if a rapid response is not obtained with steroids. In case of lack of response or repeated relapses, long-term immunosuppression with rituximab, azathioprine, mycophenolate, or cyclosporin is initiated. Supportive care. Patients are at risk for ventilatory failure and severe autonomic disturbances, both of which can be life-threatening and require adequate supportive care as well as close monitoring. Prognosis. With treatment, response is usually obtained, though this may be slow and incomplete and long periods of rehabilitation are required. Relapses are not uncommon. Outcome is poor in the absence of treatment.